Hello and welcome everybody to our April ACA Roundup. Really appreciate everybody coming out and joining us this afternoon. We appreciate y'all giving us your attention for the next 30, 40 minutes as we go through and get some more industry updates. And without any further ado, let's go ahead and get started here. And I'm just going to start out with just another very brief overview of the structure of these webinars. So these are monthly webinars that we are doing to cover industry news, O'Neill marketing news, and just other important updates that we want our agents to be aware of. This is the second month that we have done it. And as last month, the webinar slides are going to be sent out to everybody who registered after this webinar. Then we're also going to make a recording of the webinar and the slides available to everybody on your O'Neill marketing agent portal. So make sure to keep an eye on that and you can revisit this later. And the same as last time too, if you do have any questions, there should be a Q&A area on the left side of your screen. So you can go ahead and put any questions that you have in there. Just based on time constraints, we might not be able to address all the questions live, but if that is the case, then we will be responding to your questions via email once the webinar is over. And if you have a really good question, then we'll make sure to answer that for everybody or address it in a future webinar. So let's go ahead and move on to some industry news that's going on now. So to start, we're just going to recap on Medicaid unwinding since that is going on right now. And just a reminder for anybody who didn't see last month's webinar or our webinar with UHC, Medicaid unwinding is the process of each government going through and terminating Medicaid coverage now that the COVID public health emergency is winding down. So some states have already begun terminating Medicaid coverage, but all states have begun redetermination. So that's the process of going through and determining who is going to have their coverage terminated. So clients who have received notice of termination already, they can go ahead and apply for an ACA plan right now. They do not have to wait until they lose their Medicaid coverage. And in fact, we would encourage them to get on that early so that they don't experience any lapse in their coverage. And as we said last month too, this is a huge opportunity for ACA agents. It's estimated that anywhere between 10 and 15 million Americans are going to be losing their Medicaid coverage, and 2.5 million of those are going to be transitioning to a subsidized ACA plan. So we're going to see a lot of volume coming in here in the next months. And if you are unsure of your state's timelines, there is a link right here in this slide that does have the timelines for every state. And as we said last time too, this is a really good time to make sure you're up to date with all your appointments. You have all the certifications you'll need. You should go ahead and update your help on demand profile, and just in general, make sure that you are prepared for the influx of clients that are going to be coming your way. Just a little more about that. As far as applying the Medicaid SEP, so redetermination clients are going to be eligible for an unwinding SEP. And the thing about that is that it lasts 60 days from the date that they submit a new or updated application. That's very important. It's not necessarily 60 days from coverage, 60 days from the application that lets them go ahead and get new coverage before their Medicaid is terminated. And as we said, they do not have to wait for their coverage to be terminated. As long as they have that letter indicating when their coverage is going to be terminated, they will be able to go ahead and get started on that process. And all consumers are going to have to do on the application is answer yes to the question about loss of Medicaid or CHIP coverage. And then they'll have to attest that the last date of coverage was between March 31st of this year and July 31st of next year. We'll touch on that later in our presentation section. But just one other thing about that I wanted to mention is that consumers will not be required to submit documentation to verify their eligibility for the unwinding SEP. As long as their last date is within that range, they should be good. And then if down the line, if consumers are unsure about whether or not their coverage is terminated, the best move is they should contact their state's Medicaid agency. And we have a link right here in the slide that has contact information for each state's Medicaid agency. And then also even further down the line, after July 31st of next year, if there are any consumers who didn't receive a timely notice of their Medicaid termination or were unaware of it and therefore weren't able to enroll in an ACA plan, they can contact the Marketplace call center to request an SEP for the unwinding, and they will address those on a case-by-case basis. And if you need that number, again, that is right here on the slide. And then the same as last month, we just have some more resources included here. Would highly encourage you to go through those on your own time once you get sent these slides. Next up, we just want to touch again on the ending of the COVID public health emergency. And so that's going to be ending after May 11th of this year. The federal government will be ending the official COVID public health emergency. And so overall, that's going to be changing requirements for insurance carriers to cover COVID testing without cost sharing. It's also going to change their ability for providers to provide medication without an in-person interaction, though there are rules to extend that we'll be keeping up with. And then overall, ACA carriers are very likely going to be adjusting their COVID related coverages. So that'll impact things like COVID testing, COVID vaccinations, or anything else that is COVID related. And these changes will be done on a carrier by carrier basis. So most importantly, it's just crucial that you stay up to date with your appointed carriers and with the changes to their plans. And so just what do we want to do about that? Well, as I just said, just make sure that we're staying up to date with all of these changes. And if there is a change that you think impacts your clients, be sure to let them know as soon as possible. And in general, I would just recommend that you subscribe to any carrier emails or anything like that you can, because that is typically where they will be sending out all of this information to agents. Right. So next, I wanted to discuss the family glitch. And for those of you that don't know the family glitch, I'll give just a little overview. So in the past, before fall of last year, affordable employer coverage was only calculated using the cost for the employee only and didn't include the cost of family coverage. And I think this is a little bit easier to explain with an example. So just in this example, we'll have a family of three. There's a father, a mother, and a child. The father works a full-time job and is offered insurance through his job. And then when he just gets insurance for just himself, so not including his wife and his family, it is considered affordable. It's under the federally mandated affordability threshold. And so that's good. So he enrolls in his job based coverage. And then later on, he goes to add his wife and family. But as you'd expect, the premiums then increase when he adds his wife and child to that plan. And now that he has his whole family on, that plan is actually above their affordability threshold. Well, before October of last year, this meant that the family was not eligible for an ACA plan with subsidy. So it put a lot of families in situations where they had the option of either choosing unsubsidized ACA insurance, which, as I'm sure a lot of you know, can get very expensive, or they could choose a plan through their spouse's employer, which a lot of times was above the federally mandated eligibility or I'm sorry, the federally mandated affordability threshold. And so that's what we would call the family glitch. But fortunately, not only for agents, but for families as well, in October of 2022, the IRS updated their rules that eliminated the family glitch. And that's giving families access to subsidized ACA insurance that they did not have access to a year ago. So the rule now is that if the cost of coverage for the entire family, so in our example, it would be for father, mother, and child. If the cost for the entire family exceeds the affordability threshold, which is currently 9.12% of household income, then the family is eligible for subsidized ACA coverage. But it's important to note that if the employee's only coverage, so the coverage for the employee, not including the family, just a one member, if that employee only coverage is under that 9.12% threshold, then the employee still will not be able to access subsidized ACA insurance. So in this situation, the employee would still have to choose the insurance offered through their job, but fortunately, now the family has access to that subsidized ACA insurance, which will surely save them a lot of money. And so, what do we want to do about this? Well, first and foremost, we should all familiarize ourselves with these updated rules. So, the 2023 threshold for affordable insurance is 9.12% of the household's income. And it's important to note, too, that this is indexed annually, so it does change year to year. And we want to know, too, that if the coverage cost for the entire family is above that 9.12% of the household's income, then the family will be eligible for subsidized ACA plans. But remember that this may not apply to the employee. If the cost for just the employee is under 9.12% of the household's income, they are not eligible for that subsidy, even though the family now can get that subsidy. So in that case, employee would have to take the insurance to their job, but the family could still get subsidized ACA plans. And lastly, it's just very important that we're asking these clients these questions and discussing this with them while we're going through the application, or even better yet, before you start. And it's just very important to address these while completing the application, because if they are offered affordable coverage through their job and they do get on an ACA plan with a subsidy, a lot of times they're going to have to pay back that subsidy for their taxes. And that is a huge burden on a lot of families. So it's just important that we're asking them these questions and learning all that information before we get to the application and enrollment process. And again, here are just some more resources on the family glitch and the updated rules for anyone who's interested. We also have some news about Friday health plans. So recently, Friday announced that they are no longer accepting enrollments in a number of states. So far, we have North Carolina, Oklahoma, and Georgia that they are not accepting enrollments in anymore. And that enrollment stoppage is as of the dates that you can see right there on the slide. So if you have any consumers who have already enrolled in Friday plans, they will continue to receive their coverage. But if they do need to switch plans, they won't be able to switch to a new Friday plan. Fortunately, though, consumers can still report household and life changes. So if they need to add members to existing policies, they are still able to do that on their current Friday health plans. The last thing I wanted to note about this too is that it does not affect Friday plans in other states. It is limited currently now to just North Carolina, Oklahoma, and Georgia. And again, what to do on this, first and foremost, pretty much as always, is going to be to stay informed. So Friday, O'Neill Marketing, CMS, and HealthSherpa have all been releasing notifications about these changes. So just make sure that you're signed up for all of these emails and you're staying up to date with these changes, and of course, communicating them with your clients when they come through. And another thing that you'll want to keep an eye out as well is going to be subsidy changes. So in some counties, if Friday was the benchmark plan for subsidies in that county, the subsidy calculation is now actually going to be based on the next highest cost plan. And so in that county, that's going to result in increased subsidies for some of those consumers. And again, this isn't going to impact every single county that Friday is stopping enrollments, just the counties where Friday was the benchmark plan for that area. But that being said, this is still an area where consumers might be seeing higher subsidies and lower costs for their plans. And that's just always something that we want to be aware of and keep up to date and communicate those changes with our clients when they're acceptable. This is some news about SureBridge. They are doing a branding change this year. So the United Healthcare brand is going to be replacing SureBridge brands on all Chesapeake supplemental products. And this change began on March 24th, but it's going to be continuing through September of this year. And the reason for doing this is the new branding is expected to create a stronger presence in the market and use UHC's more recognizable name. So overall, what's going to change for agents and consumers? The first thing you'll probably see is that the broker quoting and applying tool is going to have a new logo on it, pretty straightforward. But I think more importantly as well, the bank and credit card statements for clients are now going to show transactions from Chesapeake-UHC. So that's something that they might want to be aware of so they don't get unexpectedly surprised by that. In future on down the line, email addresses, websites, and contact information that currently features SureBridge will be updated to the UHC brand when acceptable. And then also as well, going forward this year until September, their current products are being evaluated and they're going to be prioritized for rebranding. So those are just some changes you're going to be seeing for the next handful of months. And we have a little bit of news about CareSource in Iowa. CareSource has voluntarily withdrawn from marketing in the state of Iowa. Fortunately, CareSource wasn't actively marketing any ACA products in Iowa, but they were planning on doing so in the future. And because of that, they had allowed agents to already get appointed in the state of Iowa. So any agents who were appointed with CareSource in Iowa have been terminated from their appointment, and you should have already received an email stating that as well. And if you didn't receive that email, it'll also be reflected on O'Neill Marketing's agent portal once that change comes through as well. And similarly with Friday, this does not impact CareSource in any other states. And even in Iowa, they weren't marketing products yet, so it's not as big of a change. And the last piece of industry news I wanted to touch on is just an update to UHC's agent authentication. So from now on, when you're contacting UHC's producer help desk for broker support, Agents are now going to be asked to provide their party ID and their writing ID in order to verify their identity. But I think more importantly than that is that they will no longer be accepting NPN for authentication when you're contacting the producer help desk. So you're just going to want to make sure that you know your party and writing ID before you contact UHC for broker support. And if you don't know that, you can find your party ID and writing ID on the account info section of your UHC Jarvis portal. So just make sure that you're aware of that, and when you're calling in that you're prepared. So we're going to move on now to just some O'Neill marketing news. And the first thing we have up is something that we are actually very, very excited to discuss today. And that is our new Medicare partnership with Senior Market Sales. And if you're not familiar with them already, Senior Market Sales was founded in 1982. They're one of the largest Medicare IMOs in the country with over 70,000 independent agents under contract. They have products in all 50 states, and they are able to assist agents through top contracts, marketing programs, agent support, and they have their own innovative technology as well. And as I mentioned, we are very, very excited about the new opportunities that this partnership with Senior Market Sales is going to be bringing. We have already had the opportunity to meet and get to know a lot of their team, and we are very excited to be able to offer a lot of these benefits to O'Neill marketing agents as well. And as we make this change too, just know O'Neill Marketing is going to continue to support agents with top ACA contracts and support, and we are still always here for you. Senior Market Sales is just going to be helping us out with Medicare and opening up a lot of new opportunities for agents. So if any agents are interested in Medicare, they can email contracting at O'Neill Marketing, or just in general, you can just contact our O'Neill Marketing support team, and we are happy to set you up and get you started. And this is something that is new this year, and we are very excited about what the future is going to bring for this partnership. Next up, just a little more news about the O'Neill Marketing Spanish division. Mostly just a reminder that we do have a division for Spanish speaking agents. Currently, this includes onboarding materials for Spanish speakers. We have contracting materials and support in Spanish. And then we also have agent support that is dedicated to Spanish speakers. And again, that's just to start with. We're going to have a lot more coming with this in the coming months and years. But if you need assistance right now, you can reach right out to Jose. He is heading up our Spanish division. I have included Jose's phone number and email on here. So if you need anything in Spanish, feel free to reach right out to Jose. And just know too that in the coming months, we are going to be setting up a support hotline dedicated to Spanish speakers. So just keep your eye open for that as well. And again, I wanted to mention that O'Neill Marketing is developing training courses that are available to agents through the Training Central platform. Right now, we have trainings for new ACA agents, just something that could get you off the ground and get you the basics of the ACA industry. We have a training on the O'Neill Marketing Agent Portal and how to use it. We have some HealthSherpa trainings on how to set up and use your HealthSherpa account. And we also have trainings that go through our onboarding and make it a little easier for you. And that is, again, just to start. There will be more to come. And on this topic, too, please let us know if there are any topics that you would like us to cover or any topics that you want to see training for. We really do value all the inputs that our agents give, and we want to know what topics are going to be the most beneficial to you and your agent. So please let us know and give any feedback you have. If you don't already have a Training Central account, there is a form right here in this slide that you can complete, or you can just email me and we'd be more than happy to set you up with an account and give you access to all those trainings. And lastly, for the O'Neill marketing news, I just have some updates from our contracting team that we wanted to share with you. First is going to be just that all carriers are now open for transfers. So go ahead and put those transfers in if you need. And if you have already put any transfers in as well, we'll be contacting you to let you know about those statuses. If you need to request appointments, new appointments or transfers, that can all be done right in the agent portal account. Just go to the My Appointments tab and you can click on some new appointments. And after you request appointments, especially if they're transfers, just be sure to keep an eye out for any emails from contracting at o'neillmarketing.net. Because especially for transfers, those emails are going to contain important information, instructions, and forms that you'll need for those transfers in order to finalize everything. So it's just very important that once you request that, just keep an eye out for those emails because those are very important. And that's how our contracting team will get in touch with you if they need anything. And if you ever need to confirm contracting statuses, you can do that through your agent portal, again, in the My Appointments tab. And if you have any questions about statuses or any more particular questions, you can always reach out again to contracting@o'neillmarketing.net or call our agent support hotline. We are more than happy to help you out. And just in general, on the contracting side, we just always want to remind everybody that it is never too early to start your preparations for open enrollment, whether that be getting all your appointments set up, transferring your appointments to O'Neill Marketing, or if you're an agency principal, making sure that your downline get onboarded and set up and all that good stuff. So I know it's only right now April, going on May, but trust me, October, November will sneak up on you. So it's best to just go ahead and get that process started now. And so now I'm going to move on to the presentation section of this month. And this month, we're going to be going over using SEPs and applying them in HealthSherpa. We're going to be covering just the most common and the most popular SEPs that people use. I also wanted to do this just to show you how to apply the Medicaid Unwinding SEP. So let me go ahead and switch over to HealthSherpa here really quick. Right, and I am just on a lead application. This is just a dummy application I'm done. So I'm just going to click into here, and I'm going to go straight to the additional questions section, because that is where most of the SEPs are going to be handled and applied. And so this is going to be after you fill out all of the contact information, the income sections and everything. You're going to get to these additional questions. And so these first two questions, just about extra help, are just related to activities of daily living, other conditions, not really related to anything SEP. So, but what I wanted to show you on this page, though, is going to be this question right here, because this is the Medicaid unwinding question that I had mentioned earlier. Did any of these people have Medicaid or CHIP coverage that will end soon or recently ended? And so if you have any clients who contact you about Medicaid unwinding, this is the question that you're going to need to be looking for. And so you can see too, just if you click here, just going to ask you two additional questions. Has the household income or the household size changed since the client was told coverage was ending? And that's, of course, to just make sure that they didn't experience a windfall of cash since they got terminated from Medicaid, or they didn't go and have a child or anything like that. And then probably more importantly, though, is going to be the last day of coverage. And I wanted to mention this too, because it is the last day of coverage and not the first day that they are not covered. And that's just a really important distinction, because in this case, if this client's Medicaid was ending at the end of this month and I put 5/1 as the last day of coverage, that might impact their SEP and make it so that their ACA plan cannot start until the next month, which would be June. So just want to make sure you're putting the last date of their Medicaid coverage, which will typically be the end of the month. And so that means in this situation, Frank here would be able to get started on an ACA plan on May 1st. And then if it was for his entire family too, we would just do the same questions for the rest of the family members as well. And since I'm here too, I'll just touch on this question below. This is not related to the unwinding SEP. The unwinding SEP is just this question right up here. This, though, is what you'll want to do if you have any clients who were denied for Medicaid or CHIP. Just wanted to point that out since we're here. But if you do have Medicaid unwinding, this first question right there is what you're going to want to look for your clients. Now I'm just going to go ahead and click on to the next page here. 1 second to load. Right, and then this is another page, doesn't directly impact any of the SEPs or how you'd apply them, but it is indirectly related. So this is just asking if they are currently enrolled in coverage, and if they are, will their coverage end on or before this date, which is about 2 months from today. And so this is just important because if you did have a client who is going to be losing their SEP, or I'm sorry, losing their coverage in the future, you'll just want to make sure that you have this selected. So if we were even just doing the Medicaid unwinding, yes, he is currently enrolled in health coverage, but it will be ending at the end of the month before that date. So it's just, again, important that you answer these questions correctly. If it wasn't, you'll see that it has a list of others. It's going to ask you to tell them the kind of coverage. And of course, too, if they were not enrolled in health coverage, you could also just click no for all of them. But it's just important to know if they are enrolled and it's going to be ending, you'll need to have yes for both of those questions. And then again, these last two questions are just about HRAs and ICRA, nothing related to SEP, so I will skip right by them. And that is because this page right here, this is another important one, employer-sponsored coverage. This is more related to the family glitch that I was talking about. So if maybe Frank did have insurance through his job, you would need to select that, and then you see it's going to ask them where it is anyone else offered insurance, and does it meet the minimum standard, and then it's going to ask them the premium. Just important that you know that that is what this page, usually you're not going to select anybody, because typically if we knew that Frank does have employer insurance, we would just not have him be applying on this application. But just wanted to let you know since we're there. But this next page right here, this is the big page when it comes to special enrollment periods, because this is where you're going to apply the vast majority of them. And so we'll start up here. This first one is for upcoming changes. And so this is if someone is going to lose their coverage in the future. So this is the forecasting one. If someone is going to be losing their coverage in the next 60 days, then you're going to want to choose this one. And I just want to make that distinction because this question down here is for past tense. So if they are losing their coverage in the future, you'll want to do this one up here. If they have already lost their coverage, you're going to want to do this loss qualifying coverage. And again, I'll just click these so you can see the other questions. And just for each of these clients, it's going to ask, again, the last date of their coverage, not the first date they were uncovered, the last date they were covered by the plan. And then it's optional too. You can add in the name of the carrier that they were employed with. And it's just important that you enter the right date as well, because this is a time-based SEP. So their coverage has to have ended within the last, or I'm sorry, if this is the upcoming one, the coverage will need to be ending in the next 60 days, and then they can apply for insurance starting at the first date of the month after that. And just again, remember, this is the last date they were covered, and they're going to have to enter that as well. And I'll touch on this right now, but I'm going to come back to it later. For a lot of these SEPs, it's just good to let your clients know too that in a lot of cases, they will require some sort of verification of these SEPs. And as I mentioned with the Unwinding SEP, that was one where they said they were not going to require any verification, which is fantastic because it's just something else that the client doesn't have to worry about. But for the vast majority of these, they will usually require some sort of verification. So it's just important that you let your clients know that and that they can have that verification document available. And again, we'll come back and touch on this again in just a minute here. Then I want to come down here and show you just some of these recent changes in here. And again, with this first one, this is if someone has already lost their health insurance in the past. Again, it's already lost. If it was upcoming, they would do up here. If they lost it already, they got to do right here. Pretty much just the same thing. When did they lose the health coverage? The last date that they were covered under that plan. And then it's optional. You can list the name of that. And then same with the last one, that's going to have to have been within 60 days of this application. So if it was half a year ago, they might be out of luck. Just important to know for the clients. Another really common SEP is going to be when people get married. It's a very happy moment in people's lives, but it's very important that they can get on each other's health insurance and that they're covered for all those eventualities. And so with the marriage SEP, there are a few questions as well here that I wanted to touch on. So this is another one, the date that they got married. And again, this is going to have to have been within 60 days. They have to follow up on this relatively soon after they get married. So they can wait until after the honeymoon, but they can't wait 4 months. Then another important question though that they're going to ask and that they'll need to know about is, did one of the spouses have qualifying health coverage at any time in the 60 days before? And that's just an important caveat on this, because one of the spouses is going to have had minimum essential coverage leading up to their marriage, either that or be a member of the federally recognized tribe. But typically it's going to just be that one of them had coverage. So that's just, again, an important thing that your clients will need to know, because a lot of times they might be asked for verification. So again, they will have to have been married within the last 60 days, and at least one of the spouses will have had to have qualified health coverage in the last 60 days before the marriage as well. Down to another one, and I would say this is the most common SEP, at least personally, that I get, and that's going to be when someone changes their primary place of living. And again, it's going to ask them, when did they move? This is another one that it is within 60 days. It can be 60 days going forward, or it can be 60 days behind, but it has to be within 60 days of the date of the application in order for it to work. And some other stuff that they're going to ask them for this is just going to be the previous zip code where they lived, the previous county, and then the previous state too. And then like the marriage question, it's going to ask them Did they have qualifying health coverage at any time in the 60 days before moving? That's just another thing as well. Outside of open enrollment, moving will get them an SEP, but they also will typically need to have had some sort of qualifying coverage anytime in the 60 days before they were moving. And just another important thing I wanted to mention about the moving SEP is that that is only applicable if they change zip code or county. It's very important. So if they're just moving down the block or in the same zip code or county, it might not work. But if they are moving outside of their zip code or outside of their county, this is an SEP that could apply to them. And these last two on this page, relatively uncommon, but since we're already here, I will just touch on them briefly. And that's going to be if someone was released from incarceration, they'll just need to know the date that they were released. Again, that's another one that A is going to have to be within 60 days. And also B, very likely that they are going to ask for some proof that they are no longer incarcerated. That's just another follow up they'll have to do. And then again, adopted, placed for adoption, or placed for foster care. And I want to point this out specifically just because this is not what a lot of people think it is. So this is not the SEP that you would apply to if they added a new member to the plan. So if one of these kids, Dennis or Deandra, was recently born, this isn't what you want to do. This is if these people were adopted, or if this person was placed in foster care or became a dependent through child support or another court order in 60 days. And you'll see too, if you ask, it'll say, when did Dennis become a dependent? But this is a little different because if one of these two was a newborn child, perhaps, then you would actually add them at the beginning of the application to the members, and that will just automatically give them an SEP. This is slightly different. So I just wanted to point that out for this reason in particular. And the last SEP that I wanted to point out today is a relatively new one, but it's one that we get a lot of questions about. So I wanted to just briefly touch on it and shed a little light into it as well. And that is the income-based SEP. So I'm just going to hop over here to the income section of this application. And so what this new SEP is, it is a new one. It just started in 2021 with the COVID legislation. And what it does is it allows anybody who is under 150% of the federal poverty limit to have a year-round SEP so that they can enroll or change plans at any time during the year. So that is 150% of the federal poverty limit or under. But there are a few very important caveats about this that I wanted to point out. First of all, though, I'll just say applying this SEP, that is, again, just as simple as their income. This income right here is not within that range, but if, say, they were only making for a family of four about $28,000 to $30,000, they probably would be in that range depending on what state they're in. So if they do apply that, it really is just their income listed in this part for the household has to be under that limit, and then they'll get that SEP. But kind of the caveat that I wanted to point out, though, is that for that 150% SEP, they also do have to be eligible for ACA. And so what that means is that they can be under 150%, but also their income can't be so low that they are eligible for Medicaid. So if their income is only 50% of the federal poverty limit, that's something where they'll usually need to be on Medicaid, and so they would not be eligible for that. But that's just because they're not even eligible for ACA. But the most important thing I wanted to point out is that this SEP is one of those things that is going to vary a lot from state to state, just in how frankly useful it is. So this map right you can see right here, this shows states that have expanded Medicaid. So those dark blue states you can see there, which are the majority of states, have expanded their Medicaid programs. And these orange states are states that have not expanded their Medicaid program. And there are two light blue states here that you can see. They are states that have adopted Medicaid expansion, but not implemented it yet. So for South Dakota, they will be implementing Medicaid expansion this summer if everything goes according to plan. North Carolina, very similar. They have adopted it, but it is not implemented. It'll only be implemented once their budget passes. But those are two states we expect to be changing in the next year or so. But the big difference with this is that each of these states have then different minimum levels for ACA coverage. So orange states, so states that did not expand Medicare, all the orange states on this map, so most of the Southeast and Texas, they only need 100% of the federal poverty limit to be eligible for ACA in those states. So as long as their income is 100% or higher of the federal poverty limit, they are eligible for ACA. In those blue states, though, it's actually 138% of the federal poverty limit is lower. So if they have 100% of the federal poverty limit, but they live in Virginia, say, they actually are not eligible for ACA because Virginia wants them to go onto Medicaid instead. And then just an extra little caveat on that as well is that those blue states are actually using 2024's federal poverty limit while all the other states are using 2023. And I think these numbers will help it be a little more clear, but let me just zoom in here. And so you can see here that in these blue states, for just a single person household, right? Let me zoom up a little bit more. So for a single person household in these blue states, the minimum income that they need for ACA is $20,121, but then 150% of the federal poverty limit, you can see it right there, is $20,385. So essentially what that means is that if they live in a state that has expanded Medicaid, their window for using that 150% FPL SEP is very, very narrow. For one person, it is only $250. Now compare that to Florida, where a one person 100% of the FPL is 13,590, and they could use that SEP up until they make 20,385. So in a Medicaid expansion state, they only have about $200 window to use that SEP. Whereas in a non-Medicaid expansion state like Florida or Georgia or Texas, they have about $7,000 window to use that as well. So that's just an important distinction I wanted to point out here as well, just because we do get a lot of questions about that 150% SEP, and it definitely is very useful. It has certainly helped a lot of clients, but I think it's just important that everybody knows that depending on what state they're in, their results may vary. So if they're in Florida, Georgia, Texas, if their income is below 150% of the federal poverty limit, there's a very good chance they could get a year-round SEP because of that. But if they're in one of the Medicaid expansion states, so Virginia, California, Pennsylvania, Ohio, et cetera, all the blue states on this map, depending on their income, it's pretty unlikely that they will actually be able to use that SEP. And so I just wanted to mention that as well, because I think that's important that people know. I'm just going to hop back over here to our slideshow. I just want to click, and I just wanted to go through really quickly just the resources that we've included on this topic. So the first one is just going to be a healthcare.gov article, goes over all the qualifying life experiences that will generate an SEP. Great if you don't already know them off the top of your head. And then the second one I've included there, just another healthcare.gov article, and it addresses some more complex SEPs, more uncommon ones that you might not see every day. But if you do need to check those out, the link is right there. And then there's also this HealthSherpa SEP overview. And I really, really like this article because not only does it list out every SEP available in a very useful graphic, it also tells you how you can apply that in HealthSherpa. And I think that's important since the vast majority of our agents do use HealthSherpa. So I would definitely recommend you check out that article, maybe bookmark it as well. And then below that, that's the list of verification documents. And I had mentioned earlier that a lot of these SEPs will require follow-ups or verifications from the clients to prove that maybe their income is under 150% of the federal poverty limit, or maybe to prove that they moved or that they lost their coverage, et cetera. And so that link right there, it goes to a CMS article that lists out for every single verification that they might possibly have, a list of each document that could be used to verify. So if nothing else, I would highly recommend that you look at that article, highly recommend that you bookmark it and have it available. So when your clients need to verify some stuff, you will have access to every single document that they can use. And then below that, we have the 2023 ACA cheat sheet. That's that chart that I was just showing you with the FPLs and that state map. I find it very, very useful. It's got the FPL limits and the cost sharing reduction limit ranges for each size of household. And then below that too, it's just got a lot of good information about what counts as income and what counts as someone being in a household or not. So I would highly recommend that you go ahead and download it. It's also available if you need on the FAQ page from o'neillmarketing.net. And then the last thing on here too is just the Medicaid expansion map. It's very similar to that map you saw on the Excel spreadsheet. Just shows which states have expanded Medicaid and which states have not. And that does impact ACA directly because non-Medicaid expansion states are going to have a significantly lower lower level to get on ACA, and then they are also able to use the 150% SEP a lot more effectively in those states. So I just wanted to shout out all of these resources here. Again, you'll get all these slides in a presentation. You'll get the PDF in an email once we're done here. So I would highly recommend that you go through all these resources and check them out on your own time. And that is going to bring us to the end of our April ACA Roundup. Once again, we really, really appreciate everybody coming out and joining us here this afternoon. And as always, if you need any help at all, O'Neill Marketing is here to support you 100%. Our agent support phone number is on the screen, and as well as our agent support email. If you need anything at all, please do not hesitate to reach out. We are always here to help if anything that you need. So once again, thank you so much for joining us today. I hope everyone takes care and have a fantastic rest of your afternoon.